I've been using the medical ketogenic diet to treat my schizoaffective disorder for the last 4 months or so. And throughout this process, I've shared a lot about how I'm being followed by a care team consisting of a psychiatrist, physician, keto coach, therapist, and I've emphasized the importance of being followed by a care team when attempting a metabolic intervention like the ketogenic diet. But I've kind of realized that perhaps I'm giving the wrong impression by sharing that I have this comprehensive care team, whereby people are assuming that I have a psychiatrist who specializes in metabolic health or metabolic psychiatry, a physician who's well-versed in the ketogenic diet as a medical intervention for mental illness, and all these things, all these specialists as a part of my care team. But that could not be farther from the truth of what my care team actually looks like. So in this video, I want to clarify what my care team actually looks like and show you how you could potentially replicate it for yourself as well. So before I embarked on this project, I wanted to try to find a psychiatrist who specializes in metabolic health or who knew, more than my current psychiatrist about things like using the medical ketogenic diet as a form of treatment for my mental illness. And so what we did was we actually created a video and put a call out on our YouTube channel asking if there was any psychiatrist who fit this criteria and were interested in treating me throughout this project. And the response was not very good. We did not really obviously I did not connect with anyone, and this could have been maybe for a few reasons, whether it was that there just weren't any who fit that bill in my province, because they have to be in my province to treat me, or it could have been due to the fact that they didn't want to take on the liability of treating me in a public project like this. I don't know. But I think the reality is that psychiatrists who specialize in metabolic psychiatry or in using the ketogenic diet as a form of treatment are pretty few and far between. And it is really, really hard to get connected with these individuals or these clinicians. And for the most part, it's just not accessible for many, many people to find and connect with these clinicians. So what I decided to do instead was to just stick with my existing care team, stick with my psychiatrist, my physician, my therapist, and just kind of talk with them all about how I was wanting to try this and kind of gauge if they were open or receptive. And all of them were open to doing it with me or to kind of monitoring me throughout the process, but they did admit that they really know nothing about it. And so I added one more person to my care team who has really, really been integral in terms of bringing forward knowledge about this medical intervention. Her name is Nicole Laurent. I've talked about her multiple times throughout this project and shared bits of our sessions together as well. Basically, she is a keto coach who is a licensed mental health counselor who is also trained in nutritional and metabolic therapies for mental health. She has taught me so much throughout the last 4 months and helped me understand things that I did wrong the last time I tried keto and how to kind of optimize my approach to trying medical keto this time. And she's also helped provide knowledge and information and resources for me to liaise back with the rest of my care team to kind of help inform or educate them about it as well. I always include a link to her website in our description of our videos, but again, it's mentalhealthketo.com if you want to find out more about her services. Nicole is not the only one who provides these services, and later on in the video, I'll give you more information about how to find other clinicians like Nicole who can help you throughout this process. But basically, if you can't find a psychiatrist or physician who are knowledgeable about using metabolic therapies to treat mental illness, it is really, really valuable to have someone on your care team like Nicole, a keto coach, who can liaise and provide that information and knowledge to the rest of your care team about how to effectively navigate using it as an intervention. So it has been really important, even though they don't know a lot about metabolic therapies or using the medical ketogenic diet, to have my psychiatrist on board. He's been really instrumental in terms of monitoring me and my mental health and, overseeing medication changes throughout all of this. Likewise, my physician has been really important in terms of, again, overseeing the whole process and monitoring my health, and also requesting or doing requisitions for blood work that is needed to kind of monitor where my health metrics are throughout this. But something that's been a little bit interesting to navigate through this kind of mixed care team of mostly people who don't know a lot about metabolic interventions with people who are specialists in this, there's been a bit of a degree of tension, I guess, whereby I think there's a degree of frustration from metabolic health specialists at kind of the lack of knowledge or lack of education that exists in the typical physician or clinician who doesn't know about metabolic therapies. And part of that is that these clinicians, have no education in metabolic health really, or, treating mental illness through metabolic interventions, but they're also operating from standards of care that are based around populations that are on things like the Western pattern diet, also known as the standard American diet, often referred to as the SAD diet, which consists largely of refined sugars, processed foods, and large amounts of carbohydrates. So the issue here is that the large data sets that these standards of care are derived from are based off of populations that are eating these types of diets, and thus this, information or standards don't really apply to people who are following a completely different diet, such as the medical ketogenic diet. And so, for example, we just got some blood work back, and my physician was so good. He didn't even know what some of the blood work that Nicole was recommending were, but he fought really hard to get them for us. But then we got them back, and he didn't really know how to interpret them. And some of the stuff, especially for Rob, some of his levels, he freaked out a little bit on and was, saying stuff like, if you were a regular patient showing these signs, I would perhaps want to put you on a statin soon or something to address your cholesterol levels. And so we brought that information back to Nicole, and we also spoke with a cardiologist who specializes in metabolic health as well to just kind of go over our blood work. And they both were kind of frustrated with that response from our physician because it is not appropriate for someone who is following a medical ketogenic diet to have that response to those blood work levels. The way the cardiologist that we consulted with kind of explained it, and part of why he was frustrated with how our physician responded, was because even according to current standards of care for heart health and whatnot, Rob's cholesterol levels alone were not reason enough to put him on a statin. You have to look at other factors as well, such as blood pressure, age, smoking status, and stuff like that tell a better picture of where the cardiovascular risk is. And higher LDL cholesterol levels alone was not enough to warrant it. But, where our physician was coming from, and where I think a lot of medical professionals often come from around this stuff, is following that kind of knee-jerk reaction of seeing these levels in patients, and it usually being in conjunction with these other factors because the patients are following the SAD diet, the standard American diet, and that being higher risk. And so when they see these LDL cholesterol levels going up, even though it's kind of to be expected on the diet that we are on, there's that knee-jerk reaction to treat with statins or whatever. And so I guess that was a long story, but basically to sum it up, there's a huge lag in terms of education around following metabolic interventions such as the medical ketogenic diet. And yeah, unfortunately, it creates a degree of tension whereby people who are specialists in it get frustrated with how clinicians who are not specialists are reacting to things. There feels like a little bit of moderating that needs to happen because I want to defend my physician because I really do think he's coming from a really good place of wanting to learn more and being open to it. The reality is he just doesn't have the education or training around it. And so I think that that's a really important thing to look for when you're deciding who you want to have as your physician and your psychiatrist, is that desire or that openness to learning throughout this process and being open to new information about new ways to manage these things and, how to use metabolic interventions as treatment for mental illness. This is all really quite new. And so it's probably important to understand that there is likely going to be a high degree of self-advocacy that's involved in this journey, especially if you don't have a specialist who specializes in metabolic psychiatry. There is a huge amount of learning from Nicole and then translating that information to the rest of my care team and kind of taking that educator role with my care team. And sometimes I think that can feel quite uncomfortable to be in a position where you are educating a medical professional who, the power is usually medical professional and you, and that's just the power dichotomy typically in the medical system. And so it's a little bit of an uncomfortable practice to kind of flip those roles, and you're educating your medical professional. But yeah, again, I think that's why it's really important to find clinicians who are really open and receptive to learning more and to kind of moving through this process of learning about it with you. Now, it's probably important to clarify too that it's not just, whatever your keto coach says, you're teaching your doctor and everything's different. It is still very, very evidence-based. Everything that I'm learning from Nicole is quite often backed up with research papers or, evidence of that sort that I can then bring to my physician and psychiatrist as, evidence that this is an effective form of treatment. And I want to actually talk about a really, really valuable resource on the Metabolic Mind website. Metabolic Mind's website is metabolicmind.org. And on there, they have this entire page for, I think it's titled Families and Peers, where they have resources like a guide on how to speak with your doctor about medical keto. It's created by Dr. George Eade, and it's great. We'll link to all of these in the description below, but they also have examples of what blood work to ask from your doctor. And I mentioned this earlier in the video, but a really, really valuable resource that they have is a link to a directory of clinicians who specialize in metabolic health. So you can put in your country, what kind of clinician you're looking for, where exactly you are, and it will give you a list of clinicians that you can reach out to hopefully, help you throughout this process. They also have a whole page on their website, which is filled with resources specifically for clinicians. So if your clinician is wanting more evidence about this treatment, you can point them in that direction as well to learn more about the intervention. So I thought it was important to provide a little bit more information about what exactly my care team looks like while going through this ketogenic diet project and metabolic health project. I get so many people reaching out to me all of the time asking or, kind of desperate for help with finding a psychiatrist who specializes in metabolic psychiatry. But again, the reality is that it's still pretty new. There's not a ton out there, and it's probably pretty inaccessible for most people. And so hopefully sharing how I piece together a care team who can help guide me throughout this intervention helps you to hopefully be able to do the same too. So thank you so much for watching. And as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.